In the field of radiotherapy, we're currently trying to deliver higher doses of radiation to tumors and targets and avoid organs at risk. So in prostate cancer radiotherapy, millimeters or miles. In other words, the tighter and more conformal our radiation can be around the prostate, the more bladder and rectum that we'll be able to avoid, therefore preserving quality of life for these patients. Currently, New-York-Presbyterian Hospital, Weill Cornell Medicine, is the only institution in the tri-state area that offers MRI-guided radiotherapy to its patients, which we think will better not only track the tumor, but decrease the side effects for these patients. MRI-guided radiotherapy is exactly what it sounds like. We're using image visualization through MRI, magnetic resonance imaging, and that visualizes both tumor and normal organs, both the ones that you need to treat and those that you don't want to treat. And the radiation therapy is focused upon the MRI images that we acquire during the entire treatment time. This treatment is completely outpatient. A patient will enter the MRI suite escorted by 2 radiation therapists who will lay the patient on the MRI machine table and then slide the patient into the treatment area. The therapists then leave the room, the door closes, and then at the console, the first step that the therapist will do is perform a preview scan because the patient's anatomy changes every day. They will match this scan to the planning scan of the patient's MRI and make slight adjustments to align the prostate, bladder, and rectum, marking each of these areas. At that point, the machine will start to treat the patient and it'll proceed through the entire circumference of the patient, in other words, 11 beams around the patient. If the prostate moves out of bounds during any of these entry points of the radiation, the machine stops. Not until the prostate is back in target will those beams continue. So treatment can be as short as 20 minutes or be longer to 45 minutes. It's what that patient needs on that day for that treatment. The main picture behind this machine is really seeing what you're doing and seeing it real time. Other modalities will take an image and then while it's treating, it's blind. This machine, this technology allows you to see everything in real time while it's happening. You're not shooting in the dark. We don't have a reliance on markers or fiducials to identify what needs to be treated. We can actually see the tumor, we can actually see the organ. So what we see is what we treat. We have high confidence that this is one of the most advanced technologies available to patients, not only because of real-time tracking of their tumor under MRI guidance, but also the ability to avoid normal tissue, therefore improving on their quality of life.